Union of Nurses Secretary General Seth Panyako. Good afternoon, sir. Great to see you. Do you have any change of thought from the last time we spoke regarding the personal protective equipment for health workers and, of course, the numbers themselves? Since in the course of this week, we did see the Health CS Mutahi Kagwe say that an additional about 5,000 in total, 6,000 healthcare workers will be available to help in the fight against the COVID-19 pandemic in the country. Is there a change of thought, sir?
Grace, as far as we are concerned as a union, we have not seen any changes practically being implemented. For us, what we want to see as health workers, especially the frontline health workers, we want to see things happening that go into making sure that the work environment is safe, health workers are prioritized and they're appreciated. And we have got a point that we need the government to respond to if they are very serious. For example, we have been talking about life insurance. We have so many health workers who are dying across the country in China, USA, as well as Italy. And in Kenya, we now have about 3 health workers that have been confirmed they are infected. So the government has not put any place or responded to our call for life insurance to all frontline healthcare workers. We have also been talking about risk allowance for nurses, which is extremely low compared to other third-line, frontline health workers. They are paid 3,850, while the third frontline health workers are paid 20,000. So as far as the union is concerned, there is no response from the side of the government. So we mark the government 0 out of 10 on that one. On life insurance, we mark the government 0 out of 10. Quarantine of health workers who are involved, frontline health workers who are involved in the care, screening, and care of these suspected as well as infected health workers, that one remains on 0 over 15. The government has not taken any step to engage the union or to put actually quarantine health workers who are responsible for taking care of these health workers. They have only acted after a baby died in Kenyatta National Hospital. That is too late. We are also looking at the testing of health workers periodically after every 14 days. Those who are involved in management of these health workers, we are again scoring the government 0 out of 20. When you talk about engagement of the union by the government, all issues surrounding this pandemic, we actually rate the government 0 out of 20. When you come to discrimination in the purported or in the expected hiring, the government has discriminated the hiring that's supposed to come against Kenyans. Those who hold bachelor's degree in nursing have been discriminated. Again, on that issue of hiring, we score again the government 7.5 out of 15. There is intention to hire, but they have not hired anything. We are telling the government that we support that these health workers be hired by the Public Service Commission, because county governments do not have the capacity to hire. Some of them don't have even county public service boards. Some of them are engaging in discrimination. They are engaging in nepotism, tribalism, and some of them have engaged health workers in dubious engagement, which you don't even know. Some are paying health workers 20,000, some are paying 15,000, some 20, some 15. So we cannot actually take this important national pandemic, which is now a world pandemic, and give it to the county governments to handle that one. So our position is that the hiring of the 6,000 health workers proposed must be done by the Public Service Commission, and they should be seconded to the county government under capacity building. The government is not engaging in any research. When we started, we were told that you are safe when you are away, keeping social distance of 1.5 meters. It has now moved to 6 meters. Today I'm being told now the new guideline is that it must be 8 meters. We have not had our government, through KEMRI and other research institutions in the government, researching on this virus. It has now moved from being a conduct infection to airborne, without the government doing any research, is waiting for WHO and other international research centers to give our government guidelines. I'm challenging the government to come clear and tell the Kenyans what KEMRI is doing and other research institutions within the country. We cannot be relying on the outside institution to research for us. If that is the case, then it means if you can be infected at a level of 1.5 meters, then how many Kenyans have been infected? So we are saying that we are scoring the government in terms of research 0%, and we give our government 7.5% out of 100% in the way they are dealing with this thing. So there is no any effort practically that has been done by the government to show that they prioritize health workers, they care for the health workers, they appreciate what the health workers are doing. So as far as we are concerned, the government is scoring 7.5% out of 100%. It cannot say therefore that it is prioritizing the issues of health workers. We want the health workers' issues that they are raising during this period to be handled. And you cannot handle these things of health workers when you are not engaging them.
The Secretary General for the Kenya National Union of Nurses, he gives the government a 7.5%. But of course, we want to take a short break here on